Patrick Scanlon and Jennifer Peterson.
To palpate the clavicle, move laterally from the sternum and palpate bilaterally. That bony structure along both sides is your clavicle. Next, to palpate the suprasternal notch, move your hands immediately along the clavicle until you find a divot. And that is the suprasternal notch. Next is the sternoclavicular joint. This joint is immediately lateral to the suprasternal notch. To palpate the coracoid process, move laterally along the clavicle, stopping short of the acromion process, and about 2 finger widths down from the clavicle will be the acromion process. It can be sensitive to pressure, and it is a bony prominence. To palpate the acromioclavicular joint, palpate laterally toward the end of the clavicle. Palpation of the AC joint is felt when light pressure is immediately against the thickness of the clavicle. The acromion process is palpable by continuing past the AC joint, and you'll be on the acromion process, also known as the shoulder summit. It's a very broad, bony structure. To palpate the greater head of the humerus, continue distal to the edge of the acromion process, and you'll feel a little drop, and there'll be almost a little gap in between, and then the next bony structure you'll find is the head of the humerus. To palpate the greater tuberosity of the humerus, palpate lateral from the lip of the acromion process, and then laterally to the greater tuberosity, which lies inferior to the acromial's lateral edge. The bicipital groove is located anterior and medial to the greater tuberosity, and is located laterally by the greater tuberosity and medial to the lesser tuberosity. The lesser tuberosity of the humerus is the lateral border of the bicipital groove.
As shown on the picture, the bicipital groove is a groove between the greater and the lesser tuberosities of the humerus. The lesser is anterior in proportion to the greater tuberosity.
Is located anterior to the spine of the scapula. The tendon inserts on the greater tuberosity of the humerus. The subacromial and subdeltoid bursa are not palpable, but they are located deep to the deltoids muscle and deep to the acromion process. The pectoralis major is a large superficial muscle that runs from the lateral border of the sternum and inferior border of the clavicle and runs to the lateral lip of the bicipital groove.
As depicted on the pictures, the circles are the costochondral junctions, and what that is where the ribs are connected to cartilage, which connects it to the sternum.
The sternocleidomastoid muscle is a long superficial strap-like muscle that originates from the sternum and clavicle and runs superior and posteriorly to insert on the mastoid process. In anatomical position, the biceps muscle belly is located anteriorly along the humeral shaft, and the muscle belly is at about the midpoint of the humeral shaft.
Biceps proximal tendon's long head arises from the supraglenoid tubercle running overhead of humerus and continuing through the bicipital groove. The short head arises from the coracoid process running anteriorly to biceps muscle belly.
The deltoid muscle is the muscle that goes over the shoulder and can be divided into 3 parts: the anterior, the middle, and the posterior. The anterior deltoid attaches on the outer third of the clavicle and continues running distally to the deltoid tuberosity. The middle deltoid attaches on the lateral aspect of the acromion process and continues medially or distally to the deltoid tuberosity. The posterior deltoid attaches to the spine of scapula and continues to run obliquely down to the deltoid tuberosity as well.
The subscapularis is difficult to palpate, located on the anterior surface of the scapula.
The vertebral border of the scapula is the medial border and is located approximately 2 inches from the spine. Moving superiorly along the vertebral border, at the top of this border you will find the superior angle of the scapula. The inferior angle, moving inferiorly along the base of the scapula, will be located at the inferior angle. The auxiliary border of the scapula, moving superior and lateral from the inferior angle along this lateral aspect, will be the auxiliary border of the scapula. Moving posterior and medially, palpate the acromion as it tapers into the spine of the scapula. This bony landmark is what separates the supraspinatus muscle from the infraspinatus muscle. The infraspinatus muscle is immediately distal or below the spine of the scapula. The trapezius muscle is a large muscle that is divided into 3 different muscles as well. The upper trapezius runs from the occipital protuberance and neutral ligaments of the upper cervical vertebrae and inserts on the lateral aspect of the clavicle and acromion process. The middle trapezius muscle originates from the nuchal ligaments of the lower cervical and spinous processes of C7 through T3 and inserts at the spine of the scapula. The lower trapezius muscle originates from the spinous processes of mid and lower thoracic vertebrae and inserts on the base of the scapular spine. The rhomboids is a rectangular shaped muscle that can be palpated when the trapezius muscle is relaxed. It originates from the nuchal ligaments and spinous processes of C7 through T5. The latissimus dorsi muscle is a broad muscle that originates from T7 through L5 spinous processes and continues up to the medial floor of the bicipital groove. The teres minor muscle originates from the auxiliary border of the scapula and it is located inferior to the infraspinatus and it inserts at the greater tuberosity of the humerus. The teres major muscle is located immediately inferior to the teres minor and is located superior to the latissimus dorsi muscle. It originates on the auxiliary border of the scapula and inserts on the crest below the lesser tubercle of the humerus. With the arm overhead, the serratus anterior muscle runs from the upper 8 ribs to the anterior surface of the vertebral border of the scapula. The axilla, more commonly called the armpit, is a quadrilateral pyramidal structure through which muscles and nerves run through to the upper extremities. To palpate the lymph nodes in the axilla, have the patient bring their arm into abduction, placing the fingers inside the axilla, then have the patient drop the arm and you will feel for any enlargements. The lymph nodes should feel like small nodules and can be tender to touch. The brachial artery is palpable by gently applying pressure at the shaft of the humerus between the coracobrachialis muscle tendon and the triceps long head muscle tendon.